Have you ever wondered what being a man really means for your life between the sheets? We're often told to be tough, stoic, and always in control. But what if these very ideas, these pillars of so-called toxic masculinity, are quietly sabotaging our sexual health and satisfaction? Today, we're pulling back the curtain on a topic that's often shrouded in silence. We're going to explore the true and often hidden cost of toxic masculinity on male sexual health. It's a conversation that affects millions, yet is had by so few. Let's dive into the societal pressures that tell men how they should act, think, and feel, especially when it comes to intimacy and vulnerability. These unwritten rules can create a huge disconnect between who a man is and who he feels he has to be. These expectations often include being sexually dominant, always ready for sex, and performing flawlessly every single time. There's an immense pressure to be a stud or a machine, which completely ignores the human side of sexuality, the side that involves emotion, connection, and yes, even vulnerability. This creates a performance-based mindset where sex isn't about mutual pleasure or intimacy, but about proving one's manhood. The number of partners, the duration of intercourse, the perceived satisfaction of a partner, it all becomes a scorecard for masculinity. This intense pressure to perform can be a direct line to performance anxiety. When a man believes his entire worth is on the line during a sexual encounter, it's no surprise that his body might react with stress instead of arousal. The fear of not measuring up, of not being man enough, can trigger the body's fight or flight response. This releases stress hormones like adrenaline and cortisol, which are the enemies of erection. They constrict blood vessels and redirect blood flow away from the extremities, making it physically difficult to get or maintain an erection. This isn't just a theory. It's backed by science. A significant body of research links psychological stress and anxiety directly to erectile dysfunction, ED. For many men, the root cause of their ED isn't physical, but psychological, born from the crushing weight of these masculine expectations. What happens when a man experiences ED even once? Because of the toxic masculinity script, he might see it not as a common medical issue, but as a catastrophic failure of his manhood. This can lead to a vicious cycle. The fear of it happening again creates even more anxiety for the next encounter, which, in turn, makes ED more likely. It becomes a self-fulfilling prophecy, all fueled by the shame and silence that toxic masculinity imposes. Men are taught from a young age to suppress their emotions. Boys don't cry. Man up, don't be a wuss. These are phrases that teach boys to build walls around their feelings. This emotional stoicism is a cornerstone of toxic masculinity. It dictates that showing vulnerability, sadness, fear, or even deep affection is a sign of weakness. But what is intimacy if not a deep emotional connection? By training men to be emotionally distant, society is essentially training them to be poor intimate partners. True sexual satisfaction for both partners often comes from a place of trust, communication, and emotional vulnerability. When a man is unable to express his feelings, desires, and fears, he can't truly connect with his partner on an intimate level. The sexual act can become mechanical, devoid of the emotional depth that makes it a truly profound human experience. This emotional disconnect doesn't just affect the partner. It affects the man himself. He might feel a sense of emptiness or dissatisfaction, even after sex, because the deeper need for connection hasn't been met. He's going through the motions, performing his role, but not truly present in the experience. One of the most damaging aspects of toxic masculinity is the don't ask for help rule. Whether it's for directions or for a serious health concern, men are often conditioned to believe that seeking help is a sign of failure. This applies with devastating force to sexual health issues. A man might struggle with premature ejaculation, low libido, or erectile dysfunction for years, suffering in silence rather than speaking to a doctor or a therapist. The shame is often overwhelming. He might think, "What will the doctor think of me?" Or, "I should be able to fix this myself." This reluctance to seek professional help is a direct consequence of the belief that a real man handles his own problems and never shows weakness. Scientific studies consistently show that men are less likely than women to visit a doctor for preventative care, and are more likely to delay seeking treatment for health problems. When the problem is related to something as core to the masculine identity as sexual function, that reluctance is magnified tenfold. This delay in seeking help means that treatable conditions can become chronic. It also means that underlying health issues that might be causing the sexual problem, like heart disease, diabetes, or hormonal imbalances, go undiagnosed and untreated, putting the man's overall health at risk. Toxic masculinity also promotes a very narrow and often aggressive view of what sex should be. It's often portrayed as a conquest, something focused solely on penetration and the male orgasm. This script leaves little room for communication, consent, or the partner's pleasure. It can lead to a self-centered approach to sex, where the man is so focused on his own performance and orgasm that he neglects the needs and desires of his partner. This isn't just unsatisfying for the partner. It ultimately robs the man of a richer, more connected sexual experience. Great sex is a dialogue, not a monologue. It involves listening to a partner's body and verbal cues, exploring different kinds of touch, and understanding that pleasure is a shared journey. When a man is locked into the conquest mindset, he misses out on all of this. He might not be comfortable with or even aware of the importance of foreplay, non-penetrative sexual acts, or simply asking his partner, "What feels good to you?" This lack of communication can lead to resentment and dissatisfaction in the relationship, creating an emotional chasm that further harms sexual intimacy. The pressure to be the expert prevents him from being a curious and attentive learner in his own sexual life. So, what's the path forward? The first step is acknowledging that these societal pressures exist and that they are harmful. It's about starting a conversation and breaking the silence. It involves redefining what it means to be strong. True strength isn't about being emotionless or never needing help. It's about having the courage to be vulnerable, the self-awareness to understand your emotions, and the wisdom to ask for help when you need it. For men, this means unlearning the harmful lessons of toxic masculinity. It means giving yourself permission to feel, to communicate openly with your partner, and to see sex not as a performance, but as a shared experience of pleasure and connection. It also means seeking help without shame. Talking to a doctor about erectile dysfunction is no different from talking to them about a knee injury. It's a health issue, and there are effective treatments available. Similarly, a therapist can help you unpack the anxiety and societal pressures that may be affecting your sexual health. Challenging these norms also involves a cultural shift. We need to raise our sons differently, teaching them that their emotional range is a strength, not a weakness. We need to promote healthier, more realistic portrayals of masculinity and sexuality in media. Ultimately, dismantling toxic masculinity is not about attacking men. It's about liberating them. It's about freeing men from a rigid, suffocating box of expectations so they can lead healthier, happier, and more fulfilling lives, both in and out of the bedroom. The true cost of toxic masculinity is immense. It costs men their peace of mind, their emotional well-being, their physical health, and the potential for truly profound intimate connection. Thank you for joining this important conversation. To learn more and continue breaking down these barriers, be sure to subscribe and follow Sex Education Repo.